So my name's Louca-Mai, as I said, and I'd like to welcome you all to the webinar to launch our book on embedding young people's participation in health services. It's great to have so many people here, and I think we were amazed by how much interest there was in today and in the tweet chat last week, which I'll talk about in a minute. So I'm going to give you a really brief introduction now to what we're going to be talking about, and then I'm going to hand over to Kath Evans, who wrote the foreword to the book, and she's going to be talking a bit about why this matters. And then we have authors of 7 of the book chapters who will each have around 3 minutes to tell you a bit about themselves and their chapters. And I'm going to be doing my absolute best to keep them to time, so that we'll then have around 10 to 15 minutes at the end for a question and answer session. So what would be really helpful is if you could post any questions or comments that you have in the chat as we go along, and then we'll come back to those at the end, or as many of them as we can. So just to give you a brief bit of background, the reason this book came about is that there's been an increasing interest for quite a while now in young people's participation in the design and delivery of health services. But young people's views are not consistently sought or acknowledged, and they're often still marginalised in healthcare encounters, so in the delivery and of services. And just to clarify what we mean here by participation, we're talking about both individual participation in the sense of young people having involvement in decisions that affect their own lives and their own care, and strategic, which in the sense of involvement in the design and delivery of health services and in policy and research. So the book draws on both sort of original research and on a diverse range of practice examples. It explores the potential for inclusive and diverse approaches to young people's participation, and looks at how these can be embedded in services in ways that are meaningful and effective and sustainable. This is really about looking at how it can make a difference in practice and in real life. And although obviously in the current circumstances it wasn't possible for us to do a face-to-face launch, we wanted to have this webinar so that people can find out more about the book, but most importantly hear from the adults and young people who contributed to it, and also to have a chance to discuss how this work can inform healthcare practice, policy and research, including the opportunities and challenges for young people's participation during and after the COVID pandemic. And this also builds on a tweet chat that we had on publication day last week. And in a moment, I'll add a wakelet, a summary of the tweet chat into the chat here. So I'll post that up in a minute for those of you who weren't able to take part in that. And we're also planning to draw on the ideas that came out of that tweet chat and the webinar today in a blog post. So without further ado, I will hand over to Kath. Just to reiterate, I think for those of you who've just arrived, if people who aren't presenting wouldn't mind turning off their video and muting their microphones until the question and answer session at the end, then you should be able to just view the people who have their cameras on, which will be the presenters. Okay, thank you very much, and over to you, Kath.
So hello, my name is Kath Evans, and I'm a children's nurse and a children's champion, and I was absolutely delighted to write the foreword to this amazing book that Louca-Mai has brought us all together to actually participate in. So a real example of true participation. And I believe that participation can be magical. And it's magical because it really makes a difference to children and young people when adults trust them and believe in them, in their contributions, not only about their own health, but also about the design and delivery of services, and amplify their voices. Young people grow. Their sense of well-being and their self-worth, their resilience, it all blossoms. And a bit like Jack and the Beanstalk, they become giants. But I've also seen healthcare professionals grow as well when they have those moments of insight, when they hear directly from children and young people, when they share experience about what really matters most. And they have rich insights to share with us. But also they bring a phenomenal energy with us as well that can be positively infectious. And I don't know about you, but as a healthcare professional at the moment, I'll take energy from any source possible at the moment. And young people are incredibly generous. So the Office for National Statistics earlier on this month asked 10 to 15-year-olds what makes a happy life. And there are 4 things that they flagged. Relationships, having someone that they can trust. We can do that through participation. Having a voice and actually being listened to and a say in decisions that affect them. We can do that as well. The importance of schools and connection. I think we need to do more of that. And importantly, feeling safe. And I think through participation, we can really make that happen. Importantly, we need to walk in their shoes, but we need to walk with them. So we've got all of the policy agendas, UN Convention on the Rights of the Child, the NHS Constitution, Health and Social Care Act. Our challenge is now to make it consistently a reality. And I think this book gives loads of ideas and inspiration to do just that. Back over to you, Louca-Mai.
So I've just put the link to the tweet chat in the chat, and also some of the other Twitter handles of some of the people presenting. But I'm now going to hand over to our first chapter author, Zoe.
I'm just sharing my screen, so I'll be with you. Okay. And hopefully you can see that. Okay.
Yep.
So I'm Zoe Picton-Howe. I'm director of the Adam Bajelian Foundation. I'm also a lawyer and a healthcare law academic. The focus of my chapter is individuals, young people's decision-making and participation rather than strategic decision-making. Although in the chapter I do talk about law, and that applies to all sorts of decisions. The chapter draws on Adam's experience. It draws on what the law and ethical guidance at participation, and it draws on my academic research, which was with paediatricians around the UK. My son Adam sadly died in 2015 from sepsis, aged just 15, after he very sadly, his voice wasn't listened to and he wasn't able to participate in decisions. Adam was a bright, gifted boy, top of the class in mainstream school, a multi-award-winning poet, well known in mainstream and social media, and a healthcare blogger and advocate. He had extensive experience of healthcare across the UK in all these hospitals and also in the community. As I mentioned, the chapter explains what international law, common law, or you might know that as case law, and professional guidance says about young people's participation, what it says should happen. But it also shares what 38 senior paediatric consultants from around the UK told me about what actually does happen and how they either help or hinder young people's participation in decisions. And to summarize what they said, they really fell into 2 groups. The paediatricians either described themselves or their colleagues as softliners, and this slide shows how they made their decisions. But at the heart of their decision making was participation by young people. That was central to their decision making. But there were also, I was told or described, hardliner paediatricians who make these decisions in this way. And sadly, participation was very far from central in their decision making. So my chapter makes some recommendations. When I analysed what the paediatricians told me as a lawyer, it actually became very clear that it was the softliners who made young people central to their decisions, who were the ones that were following the law, and the hardliners who weren't. So I came to the conclusion that better education in law and ethics was needed for health professionals. And not only should this come from lawyers, but also from young people who are the best advocates at explaining the way things should happen, as my own Adam showed. I also advocated the better use of advanced care plans. And also I raised the question of whether young people under 16 a statutory equivalent of the Mental Capacity Act, which only applies to 16s, to make what should happen and their participation much clearer. Thanks very much.
Just to say, yeah, that the book is also dedicated to Adam because he inspired both the research which led to the book and so many other people and you know, so much other work that's going on in this area. And in the chat I've put a link to the blog, which includes some of the poems that he wrote as well. So thank you very, very much indeed, Zoe. And now over to Kate and Amy.
Hi everybody, my name's Kate Martin. I co-authored a chapter with Amy Felton, who really unfortunately can't be with us today. I also want to apologise for the noise. Befitting for a launch of a healthcare book, I've just been to a healthcare setting for some tests, so I'm sat in a cafe reporting live as we speak. So our chapter focused on shared decision making with young people in mental health services, really trying to understand what are the challenges and complexities that surround shared decision making, to really think through how we can progress and give young people more choice and more control over some really critical and important decisions in their lives. Now, part of the motivation for doing this research was that often we hear about decision making, that if only professionals tried harder, or if only we skilled up young people, then all of a sudden decision making would be solved and young people would have more choice and control. But I think what this research showed really clearly was that obviously often the lack of decision making, the lack of power or choice and control isn't just down to a lack of goodwill of professionals, that many of them are desperately trying to involve young people in choices about their care. But there are all sorts of challenges in the way that services are designed and set up, particularly inpatient mental health services where most of this research took place, that get in the way of them being able to give young people choice. So often services are designed on the management of risk rather than choice for young people, and that was a real factor that kind of got in the way of staff's ability to make choices. Or that in mental health inpatient units, so many things happen, so much of the environment is structured and routine that actually there often feels like very little choice, that often staff felt like there was very little opportunity that they could offer young people, and felt like although they'd like to offer more, that perhaps they were constrained by the lack of choice that they felt they had. Also, there were some attitudes around, particularly around young people who've been given certain diagnoses and their ability to make choices. And again, that got in the way of people's kind of knowledge and ability of how to involve them. Equally, young people often felt very powerless. So even though they wanted to make choices, they were quite capable of making choices. That being within such a new and strange and unfamiliar environment like a mental health service, and particularly an inpatient service, really made them feel quite powerless and able to make choices because everything around them was so strange and so new and uncertain. So the chapter really outlines that and many more of the challenges and issues that get in the way. And the chapter also talks about a model called Open Talk, which is really about giving a framework to guide conversations to help young people and professionals work better together to make choices. Time and time again, young people tell us that it's not just the output or the outcome of the decision that's important. In fact, what's more important is that time to think and talk together. And in fact, in the research itself, the biggest single factor to enable young people to feel like they had more control was about time and talk. And they often talked as time, that time and talk with professionals equated trust. It allowed them to believe in themselves, it allowed them to believe in the opportunities that the professionals are trying to facilitate with them. And the Open Talk model, you know, it's not a magic framework that you follow step by step and out the end pops a magic decision, but what it does do is allow that time and space to build good valued relationships and really to allow young people and professionals to share their expertise and build hopefully trusting shared decisions together. So I hope you look forward to reading more in our chapter, and thanks very much. Nice to meet you. Back over to you, Louca-Mai.
Perfect. Thank you very much, Kate, and perfectly on time as well. So yeah, sorry Amy wasn't able to join us, but yeah, do send her all of our best. And yeah, as I said, do put any questions or comments or any thoughts that occur to you during the presentations in the chat as we go along, and we'll pick all those points up as much as we can at the end. Okay, so over to you, Lisa and Sheila.
Thank you so much, Louca-Mai. I just wondered, did you have the PowerPoint to share, or shall I share my own screen?
Yeah, I can share that. That's fine. Let me just find that.
That's really kind to you. Thank you so much. Well, while you're doing that, thank you, Louca-Mai, and good evening, everybody. Just introduce ourselves. I'm Lisa Whiting, and I'm here with Sheila Roberts. We're both from the University of Hertfordshire, and we wrote chapter 3 of the book. The main theme of our book is about the NHS England Youth Forum. It was an organisation that was established in 2013, and in 2015 to 16, we were asked to undertake some evaluative research of the work that the NHS England Youth Forum had undertaken, and also to think about the impact. We undertook the research with the young people that were the members of the Youth Forum at the time, and as a direct result of the data analysis, we were able to reveal this model, which came directly from the work that the young people themselves had done. And we share this with you this evening briefly. So at the very centre of the model is the young people themselves, because as Kath has already alluded to, these people are passionate, totally committed, often volunteering in many other guises, and really do want to share their voice and their expertise. And although these people do not wish to have any funding themselves or financial gain, one of the things that they were very aware of is the need to have a good funding mechanism to support any forum. And in particular for them, it's not just the cost of employees, but also travel expenses, accommodation and so forth. And that brings us to two other branches, the youth workers and knowledge experts. And the young people that we interviewed all said that actually these are key. If you haven't got adult experts to work around with you, then a youth forum could actually flounder. So the knowledge experts were the people working in the NHS who were able to help the young people navigate the NHS systems and processes and help them to familiarise themselves with it. The youth workers were the British Youth Council, and they supported young people on a day-to-day basis and played an extremely valuable role. Finally, the impact of the community for young people was absolutely key, because all of these people had a very, very good insight into their own local community. This meant that they were able to disseminate information both nationally when they met and also locally in their own areas. And this is something that one of the young people that we interviewed called the ripple effect of disseminating information more widely. So there's no doubt about it, in summary, that the NHS Youth Forum is a unique body. It is leading the way in so many ways and has meant that other youth forums across the country have been instigated. And we offer this small model as some insight to the components of success that can underpin a youth forum. Thank you very much.
That's fantastic. Thank you very much to both of you. That's lovely. And I'll in a moment I'll put in a link to the NHS England Youth Forum in the chat as well. And I think we have a few people, members of the NHS Youth Forum joining us today. So again, any kind of comments or questions that you want to put in the chat now, we can pick up later on. So I'll now hand over to Emma from RCPCH and us. Emma, do you want me to share slides or do you want to do it yourself?
If you've got them up already, then I'll let you do them if that's all right, Louca-Mai.
Yep, sure. Just let me know when you want me to move on to the next one.
Yep,
Hang on.
Will do. We'll do a press conference. Next slide, please.
Yep, exactly.
So, hello everyone. My name is Emma, and I'm the Children and Young People's Engagement Manager with the Royal College of Paediatrics and Child Health. And I'm here with one of our contributors, Charlotte, who actually helped to start the programme 5 years ago. So the first thing I'm going to do is just ask you all to close your eyes and think of your biggest secret. Think of the one that makes you feel sick in your stomach. Keep thinking. Okay, you can open your eyes now. How would it make you feel though if I told you to tell a room of strangers your secret? This is how children and young people can sometimes feel about their health, in the dark and afraid, and not sure if the person they're going to tell will understand their secret or be able to help them. So that activity was, or that kind of like statement is one of the activities that we use for some of our training, and it was created by a group in Wales who wanted people to understand how it can feel being a child or young person accessing health services. So we're a UK-wide programme, RCPCH and us, and we get to work with children and young people aged 4 all the way through up to 25 to get them involved in improving child health services so it meets their needs. So that activity where we were in Wales was one of the ways that they wanted to really centre healthcare workers in understanding their experience. Our chapter explains how our approach works, so how we get diverse and inclusive opportunities for over 2,000 children and young people each year from all different backgrounds and locations and experiences so that they can really try and help shape and inform policy and practice. We've even managed to keep this going virtually through the pandemic with sessions like tonight and one that I was just doing before I came on. Charlotte's going to tell you a little bit more about what's on the next slide.
So hopefully you can see a quote from the Voice Bank, which is a bank of children's quotes that they've told us how they feel about their healthcare. So it says, we need doctors who are aware of our whole life and experience, that know how to empower us to be able to speak up, who use different strategies to support our voice in clinic. So through the experiences of young people, paediatricians, parents and carers who helped to write the chapter, we looked at how to build up the evidence of these voices and the wishes and needs of children and young people to make a difference, how to involve them meaningfully in governance, to have their voice heard and to be able to influence audits and look at the impact of the work personally in the communities and for the NHS.
Thanks. And our next slide is kind of like the essence of everything we do. So it's all about equal voices. So we share through the chapter challenges and how we overcame them, some things that we're really, really proud about, and the way that we actually involve children and young people, and how we do that from starting where they're at. But we also look at our diversity approach. So that's about having universal children and young people through schools, youth groups, community groups, and outreach, targeted groups that share experiences like being in care, young carers, or going to special school, and also those with specialist health experiences who we get to meet in paediatric services, clinics and wards, and all of them come together, and you can see lots of examples through the chapter to try and help make child health services better. So we use games, play, communication aids and a whole range of tools, and try and do as much as possible in as many different places as possible. So hopefully tonight and the book also will help you to be inspired and to maybe get in touch with us and some of the other chapter leads to talk about young people's health participation. Thanks for listening.
That's fantastic. Thank you very much, Emma and Charlotte. And Emma, if you want to put any of those links in the chat as well for people, then yeah, do that as well. That'd be really helpful. Okay, so thank you very much. Now over to Lindsay and the young people from the Association for Young People's Health.
Hello, my name is Lindsay Starbuck from the Association for Young People's Health, and I co-authored the chapter with some other colleagues, as well as with Jack Welch and Kersha Walker, who are here to present with me. In our chapter, we share participation projects where we involved marginalized young people, and by that we mean young people who face stigma, discrimination, or barriers to accessing services. So we talk about how it can be done when adults put in a little bit of extra effort to ensure that the work is accessible, flexible, and safe. If health services are supposed to meet the needs of all young people, it's up to them to seek out all views. In our experience of doing this work, we found that when marginalized young people are able to work with their peers, it can actually help break down isolation and shame. When adults include marginalized young people, it not only shows that they respect their right to have a say, but also what they have to say. And as Kath alluded to earlier, that it's oftentimes things that adults have never actually thought about. So there's loads to learn from young people. Also that when they are excluded from this work, the barriers, stigma, and discrimination, the very things that keep them marginalized, are maintained. So I'm going to hand over now to Jack and Kersha, who are going to share some examples of how and why they've participated in projects.
Hello, my name is Jack Welch. Hopefully everyone can hear me. Sometimes my internet does fluctuate. So my contribution was to a case study that I worked on with a national youth charity called Ambitious About Autism. And this was a campaign that was largely devised by the young people from a participation program that became Know Your Normal. And Know Your Normal was a campaign that was focused on the experiences of autistic young adults aged 16 to 25 to better understand the mental health needs and their experiences within gaining and accessing healthcare services. So I was part of a co-production team with UCL, University College London, and along with the Centre for Research in Autism Education and two other autistic individuals, we published a full piece of research. I will share the link afterwards, and that details in full some of those particular issues that young people who are autistic are facing at the moment. There is also additionally a toolkit that is also available and was also co-produced with young people and the Ambitious About Autism team, so that young people can use that as a self-help measure to indicate how they're feeling on a day-to-day basis and what their normal looks like, essentially, because the aim of that campaign was to reclaim the word normal. So I will share more details afterwards, but I will now hand over to Kirsha.
Hello everyone, so my name's Kirsha. I also am with AYPH currently and previously. I've been involved in quite a few youth organisations and projects for about 12 years now, both as a participant, as a volunteer and as a professional. And I mean, our chapter especially kind of focuses on how children and young people have benefited and continue to benefit throughout their life of their experiences of participating directly within services, specifically within health services. From the engagement that I've been in participation with myself has been within a focus on sexual violence services. So I just kind of wanted to reiterate that and say that children and young people, the things that are set there to protect children and young people aren't set there for barriers. They're actually set to protect and assist those working with children and young people. The benefits that they get from this, alongside autonomy, confidence, and gaining their dependence upon themselves again as well. I mean, the benefits that I've had in participating in services I still reap from them now. Is one of the reasons why I went to university and such like as well. This kind of stuff is still important to me. I still think that children and young people should be at the centre, if not the forefront of services, not just used for tokenistic reasons or to be a part of a service to assist people's research or agendas, but also to be there at the forefront to help themselves, like I said previously, with their autonomy and confidence by focusing on what they can help and mutually get from services, not just a one way. And I think one of the most important things is to know that you're really truly ready to work with children and young people when you're ready to listen to their opinions and not just your own. To take a sort of back seat and really understand what children and young people really want from the service and want from you. So yeah, that's all I really have to say, and thank you very much for having me.
Thank you all very much. That's fantastic. And as I said before, do kind of put any sort of comments and questions that you have. I know we're kind of rattling through sort of a lot of really amazing stuff really, really quickly, so we can kind of have time for questions at the end. But do add some comments and questions as we go in the chat, and we'll pick those up. Now, I'll now hand over to Sophie and Simon from RAISE.
Hey everyone, I'm Sophie, and I'm going to talk a little bit about RAISE's chapter, which I co-wrote with Simon and the rest of our team at RAISE. So RAISE is a charity which supports young people who have chronic invisible illnesses, particularly in school. And our chapter largely focuses on looking at our organisation and how we involve young people in our work. But we actually take this one step further, and we're led by a board which is half young people. And I'm going to talk now about how we work, how our organisation came about, and how it continues to operate. So the thing that kickstarted our organisation, the first event, was a small focus group with other children and young people to discuss their experiences, particularly in school, and how their illness and their health had impacted their relationship with school. And one thing that I think is a good side note is that it's vital that children are also involved in healthcare, not just people in the 16 plus bracket, who might sometimes be easier to recruit or feel less scary to work with. Children's involvement is really important here as well. The workshop was a really great success, and it was a really simple format. We were simply sitting together and sharing our experiences, and that was a really great starting point for what then turned into a bigger project. So then we scaled this up. We were keeping stories of children and young people as our focal point, but we added more structure and made the meetings bigger. We also invited different groups, and that included teachers, parents, families, health professionals, and the difference in how these groups communicate each other, beginning in sessions in comparison to the end of the session, is really incredible. So during this workshop meeting, we established key priorities for young people in the simplest way. We just asked them. We asked them exactly what the problems they faced were, and then we came up with ways to solve them. We used the experiences and knowledge in the room and decided the best way forward was to collate all of this into a guide for teachers, and this guide would be then given directly to teachers and would be accompanied by training sessions delivered by the young people themselves. We continue to create this pack over the next couple of years, and we're delighted it's now complete. During different stages of development, we took it back to the young people, some that have been with us from the very beginning, some that have joined along the way, and we always made sure that that vision and their priorities were being presented exactly as they wanted them to be, and that was a constant throughout. So then that way we were taking their exact priorities, their experiences, and putting them together in a way which works for them and which works for teachers. And we kept this in mind and never put our own spin or agenda on it. And this is how we've kind of worked throughout. So recently we've been exploring the next steps for our organisation. And now that the pack's been completed, we're particularly interested in looking at how we can support people during the pandemic, particularly our young people with chronic illnesses who might be left out of the conversation. And so we made a survey. We have sent this off to hundreds of young people who've responded, being so open and honest about their experiences. And once again, telling us exactly what problems they're facing, how we can solve them, and together we're working together to create content, whether that's blogs or social media things, which the young people are really engaging with, or bigger national campaigns to solve the difficult. And at this point, that kind of way of working is how we ensure that their exact priorities and their focuses are what we're working towards at all points, and we're constantly adapting and changing to the exact needs of our young people. Thank you.
That's fantastic. Thank you so much, Sophie. That was amazing. And I see Simon's put in some information in the chat as well. I think a couple of people have asked about sharing the links in the chat, and we can certainly do that. But I've also said you can also save the chat, which would include all the web links that have been shared. And now, just so we make sure we try and stick to time, and last but not least, I'm going to hand over to Chloe from Investing in Children.
Hi everyone, my name's Chloe and I work for Investing in Children, and I'm just here with Lindsay, who was one of the young people involved in one of our projects, who's going to tell you about her experience. The screen share won't work, Louca-Mai, but that's okay, I can just chat. So our chapter discusses our unique approach and why it works, case studies by children and young people, and also how we can all listen to children and young people. So at Invest in Children, we use a distinct approach and we measure our effectiveness in terms of the extent in which change is achieved. So we know that every child and young person has a right to have a say. And we believe that this works because we are really honest with everyone, so we can't guarantee change, but we know that children and young people are as capable of understanding this and dealing with this as any other group. And we also put our beliefs into practice. So we have a group of children and people who scrutinise the work of our team, and we also have 3 young directors on our board. But the political reality is we often fail more than we succeed, because the power differential between children and adults is so wide. And children and young people are often seen as lacking the knowledge, experience and ability to participate, but the children and young people continue to really enthusiastically engage with us. So we really believe that the purpose of the participation is much more important than the process or structure. So it's really about really listening and making changes. We believe that the participation should be concerned with the lived lives of children and young people and what's important to them. It needs to be inclusive, so we all need to create opportunities for them to participate in their own terms, and it needs to be transformative. And we believe that if these things are followed, it should help to create the circumstances where children and young people's engagement will be easy to secure and sustained. And I'll just pass over to Lindsay, who's going to tell you about her experience.
Hi, I'm Lindsay, and I'm a young person who currently attends YS Cafe, which is a group where we explore through art and we play board games. And through that, we're able to talk about our problems if we feel comfortable with other young people and the young volunteers there. Also, through me doing this project, I've built my confidence a lot, and it's made me more aware of the services that are out there for me and that my voice is important. And throughout doing this, I've been to a lot of agenda days where us young people, we actually get listened to and our thoughts are important. And obviously due to COVID, we've had a lot of Zoom online sessions still. So they've still thought of us and we're still able to do what we do, but just through the internet. Thank you.
Thank you both so much indeed. Yeah, thank you, Lindsay. That was fantastic. And we'll come along in a minute just to your questions and comments. I know there's a few things being posted in the chat, which is fantastic. Do feel free to turn on your mics and your video now, and let us know if you've got any comments or any questions about anything any of the presenters have been talking about. And I think Simon, somebody put in a question already, hadn't they? I think it was, yeah, Emma had put in a question to participants about what's been a standout piece of youth participation for you over the last year.
Shall I start while people are unmuting furiously?
Yes, please.
One of the things that definitely stands out for me this year is that we've been running a book club during COVID, where we've had young people looking at the kind of like published surveys of other young people's feedback and children's feedback during the pandemic and about how it's affected them. And it's been we've never done anything like that before, but it's just been really nice every week getting people together just to see each other, to like catch up, but also to feel like they can make a difference during the pandemic. And what's super cool is tomorrow they're going to kind of like be publishing their findings and what the key themes are. So for me, trying something different, going with it, doing it virtually and doing it on COVID has been like a massive standout for this year.
Thank you, Emma. That's fantastic. And I think, I mean, that was interesting. One of the things that came up a lot in the tweet chat was about the impact of the COVID pandemic on children and young people's participation. And I wonder if anybody has any thoughts on that.
I do, yeah. So it's been a really interesting year for many of us working with young people in participation and trying to really ensure that we hear voices of everyone. We had some particular struggles in terms of technology and organisational changeover to newer technology, and then what young people have access to, and then how that links in with other things that young people use. So for example, we work with several young people who use eye gazers to communicate, but actually where they were joining chats on their eye gaze, it then wouldn't pick up what they were saying, and we had to find different solutions and solutions on how we could get them to mute and unmute when they didn't have use of their arms and were relying on their eye gaze. So that was a really interesting piece of work. And in fact, one of the young people today that we've been working with over the last few years now, actually, he has today spoken at an all-party parliamentary group, if I've got that the right way around, specifically for SEND, and looking at the impacts COVID's had within their education and providing care and support throughout that. So that's been really interesting work to be part of.
That's fantastic, Debbie. Thank you so much for that. And yeah, I think absolutely. I think a lot of us have had to kind of move a lot of involvement and participation work online very quickly. And it's been, you know, a very steep learning curve for a lot of people. But I think it's interesting that I think for some young people, it seems to have actually enabled them, made it easier for them to be involved. But for others, I think particularly around, you know, digital poverty or accessibility, there's been all kinds of issues. I'm just posting a link in the chat to a blog post that I wrote with some young people I work with about some of the learning that we've had about involving young people in health research. But another thing that came up last week was also in terms of COVID was about, there's quite often a perception that children and young people services tend to be the poor relation, if you like, in the NHS and in health services generally. And whether that's even more the case now during COVID, when obviously so much care is focused on adults who are more impacted, and whether it's, you know, it's kind of a harder fight to get children and young people's participation embedded in services rather than being seen as a nice thing to do when you've got time. So I don't know if anyone has any thoughts on that, or indeed anything else that's been discussed today.
was going to mention as well, when you said about moving things online with children and young people in terms of participation, that also something from a vulnerability background as well is that, you know, it's not necessarily okay for children and young people to participate in their homes. So when they're actually around their family or their siblings or carers or wherever it is that they may be, it might not necessarily be a safe environment for them as well. So I think for, especially in child sexual exploitation and sexual violence and that sort of side of things, that participation has been difficult in that way, just purely because of not being able to engage people and having a safe space for them to engage. That's a sort of difficult one. And I think during the beginning of the pandemic, I was undertaking a research at Nottingham Trent University with students, slightly different, but I mean, that all then moved online, and some of it we were able to do, but a lot of it we weren't actually able to complete. I think I definitely share the concerns with.
Yeah, I think those are really, really important points. And I know I've speaking to some young people about that recently, that I think even when it's not necessarily a sensitive topic, a lot of, you know, more and more services are moving towards online consultations where possible. And a few other young people have said to me that, you know, it's that whole thing about having to have an appointment online when their parents are within earshot, as opposed to normally when they'd be, you know, in a room with a clinician and the door shut, and how that makes them feel generally.
Just to add on my part quickly, because I've had some experience, not necessarily with young people purely in this regard, but more people with learning disabilities, including predominantly adults, as I work for MenCap in one of my roles as the chair of their Voices Council. And in our experience, it's been quite a challenging set of circumstances we've had to adapt since March, because we had to cancel our face-to-face meeting quite last minute in March, and then May's meeting we had to cancel, as we normally meet 6 times a year, and there were members that we knew of that had no or little online access to participate. And one of our core themes, or you know, our raison d'etre is inclusion and the importance of inclusion in our practice. And we couldn't call ourselves to be inclusive if there were only a few of us who knew how to use Microsoft Teams as our place of meeting, as the online substitute. But there were members who don't even have, say, a mobile phone or a basic standard mobile phone, or the support available to read and interpret information, because there were those who had difficulty reading as well and needed that provision. But it makes it very hard when you can't be physically close to people or be in people's houses, and support workers having to wear full protection gear as well. So there was those factors that we had to take into account, and we have begun to develop and improve on that situation and provide that support and enablement, but it's taken much more time to make that happen.
Yeah, no, that's fantastic. And I think you're right, Jack. I think sort of a lot of those issues are really coming out as well. And I think that's really key. But I think, yes, Lindsay.
Yeah, I just wanted to sort of echo what both Kirsha and Jack were saying with a project that I've been working on, where we are talking about sexual violence, and it is about group work. And just in addition to the things that they were talking about, just the sort of difficulty of creating a group dynamic when you're not in the same room together is really something that is a struggle. And, you know, even if you're not talking about really sensitive issues, there's just something about being in a room together, having, you know, tea breaks and lunch breaks together where you can have informal chats in addition to the sort of scheduled things that are part of a workshop is something that's really lost when you move completely online. So it's just the number of things that complicate the sort of online engagement for various young people. There's just a lot of barriers. So yeah, I just wanted to echo some of that and talk about some of these other, you know, that there are lots of things to consider to make sure we're not excluding anyone from that involvement.
Yeah, absolutely. I think you're right. And I mean, that's the case both in terms of participation, involvement, activity, but also in terms of accessing health services as well. So that's fantastic. And is there anything else going where we're we're kind of to time now, so I don't want to kind of run over too much into people's evenings. But is there anything else that any of the people who've joined us today want to say before we finish up? Yes, Harris.
So I've got two things. The first thing is the NHS Youth Forums taking part in NHS's England Engagement Festival, and we're doing a presentation about embedding youth engagement into practice, so it'd be great to have some of you come. And the second thing is a question to all of you is, do you think there should be a policy or system that is implemented to ensure we're engaging young people effectively and in the same way, sort of a baseline for engaging young people?
Yes, absolutely. So yeah, in relation to your first point, yes, definitely. Let us know about that. That would be fantastic. And yeah, I mean, I think in terms of the baseline, I think that's a really interesting idea to explore. Kath, did you have any thoughts on that? You're nodding vigorously.
Yes, please. I think that's a brilliant idea. And I'm really excited by the National Children and Young People's Transformation Programme that might just ask our sticky toffee puddings or emerging integrated care systems, we do like our long titles in the NHS, to actually make sure that children and young people's participation is absolutely embedded. But I'm just going to reflect back. I think there are two levels, and I think you're so right. It's really important that we get children and young people's participation in their care right as well as strategically in terms of design and delivery. And NICE are actually going to be publishing a guideline next year focusing on children and young people's experience of care, and their voice and participation is absolutely embedded in that as well. So we do have some national system leaders that are really pushing forward in this agenda. But I think youth voice and us all working together and evidence-based, growing that evidence base, such as you've actually done with this book, Louca-Mai, is going to be incredibly helpful. And, you know, we just need to keep going with this agenda. It feels as though we're just scratching the surface. We've got so much more to do.
Yeah, absolutely. I think there's an awful lot to do, and I think one of the things, so I think it'll be really good if anybody has any ideas. I know people have been posting things in the chat in terms of links or reports or events or everything. So if you've got anything else you want to share, do that, and we'll make sure we collate it all. But I think that's really important now, is to kind of look at how we can build on a lot of this work and make sure that it's embedded into practice, particularly given that everything is changing pretty fast at the moment. So it's creating challenges, as people said, but I think there's also opportunities, and there seem to be more opportunities for things to change. But I think, as Kath said, it's going back to what I said right at the beginning, that this is about individual participation and children and people having a say in the care that they receive and the treatment that they receive, as well as at a strategic level. And it's important to kind of keep both of those elements in mind. Thank you all very much indeed, and it was lovely to be able to have these conversations. And I think one of the things that came out of the tweet chat last week is I think we were talking about having more of those conversations, because it seems like there's a real community of interest. And I think what's been really nice with the book and the tweet chat and today is that it's been about adults and young people coming together, not adults talking about young people's involvement. And for me, I think that's really fundamental. So thank you all very much indeed, and enjoy the rest of your evening.